You're still watching NTV Weekend Edition, and if you're just joining us, I am Sandra Twinobdio, and our sign language interpreter today is Maureen Nambalira. Well, the Aga Khan University is a leading not-for-profit entity, which is part of the Aga Khan Development Network that reaches over to millions of people across Africa and Asia every year. The institution is a major contributor to the provision of quality healthcare to the East African region through its training programs, which have produced thousands of healthcare professionals, and more directly through the provision of first-class medical care in the hospitals that are affiliated to it. In fact, tomorrow, which is going to be the 8th of February, Aga Khan University will be holding its 17th convocation ceremony. Also right now under construction is in Kampala is the Aga Khan University, which upon completion will offer world-class facilities, many of which are currently unavailable in Uganda. So tonight we have three people in studios with us today to help us get a better picture of how the complementary aspects of training and quality healthcare provision tie into the Aga Khan Development Foundation's work in Uganda. I will start once again, Aga Khan Development Foundation's network in Uganda. Our very first guest in studios tonight is Dr. Sean Boluki, who is the Chief Executive Officer of the Aga Khan University Hospital in Nairobi. And what we should know about him is that he's also overseeing the Aga Khan University Hospital project in Uganda. He's seated right next to me. Glad to have you on the show tonight.
Thank you.
We also have Dr. Grace Edwards, who's also joining us today to give us a brief on what is happening at the institution. What we should know about her is that she is a professor at the School of Nursing and Midwifery at the Aga Khan University in Uganda. Welcome to our studios tonight.
Thank you.
And finally with us in studios is Mr. Joseph Mwizera, who is the academic head of the School of Nursing and Midwifery at the Aga Khan University in Uganda. Welcome to our shows tonight.
Thank you, Sandra.
Well, I want to start by saying that when I look at this brochure, yes, this one, and maybe also you who's watching us at home, it says empowering the people of the developing world. I would like to start by asking you, Mr. Boluki, what has been your greatest impact in the East African Union, in the East African region?
Before I joined AKU, I was the CEO in United States, and I run hospitals in US for 30 years. But you come to a point in your life that you reflect back and you want to know if you have contributed or not. I decided to join basically Aga Khan University Hospital, and since I have been with the Aga Khan University Hospital, our goal has been to bring quality patient care in East Africa. Since I have joined the university, for example, in Nairobi, we have brought a neuronavigation equipment which allows the patients to access neurosurgery. So far, the university has done 65 open heart surgery. We are the first hospital in East Africa that brought basically a PET CT and cyclotron to East Africa. And we have designed Aga Khan University Children's Specialty Hospital that will be the only specialty children's hospital in East Africa. And recently we have also recruited a full professor from University of Alabama for our Cancer Institute. And the university in Nairobi has been designated now as a site for clinical trial for cancer. And also building a university campus in Nairobi and planning a university hospital here, a academic building and student housing in Kampala. I believe that will be transform the delivery of healthcare in Uganda and ultimately contribute to the well-being of the citizens in East Africa.
And maybe to ask you once again, I know you do want to provide citizens of Uganda with quality health care. What forced you, or what drove you? What made you think like, look, Uganda needs to have this same facility, just like we have it in Nairobi?
You know what, 2 years ago, president of the university approached me and asked me if I would not mind to take over these projects in Uganda. I thanked him for the opportunity. I said, but before I really do that, I need to go to Uganda and spend some time there. When I came here, I went and I looked at different institutions. And I came to a realization that building a university hospital here, in collaboration with colleagues in medical field and other universities, ultimately is going to contribute to improving the quality of healthcare in Uganda. Okay. For example, this hospital that we are building is all based on the North American standards and the California standards. And the intent is when the hospital is built, we will get the accreditation from Joint Commission International, from the College of American Pathologists, and other international accreditation body, because that's a testimony to our commitment to quality. And from my point of view, it doesn't matter where you are born, either in Africa, North America, or Europe. Quality patient care is a fundamental right of every human being, and that's what we are trying to do here.
So anyway, talking about quality healthcare being a fundamental right to every human being, I would like to pass this question to you, Mr. Joseph. What, for instance, I know you joined the institution in 2011. How many candidates or graduates you have gone through the institution so far, since its time of inception?
Thank you, Sandra. Since the time of inception, and that was in 2000, the Aga Khan University School of Nursing and Midwifery has been able to graduate over 800 alumni. And those 800 have been in 3 programs, that is a degree in midwifery, a degree in nursing, and a diploma in nursing. These are some of the programs that we see that are highly needed within the healthcare in Uganda. Tomorrow is our graduation day, the 17th graduation, and we also expect to get another 121 joining our alumni, and these are also spread into 3 programs. Thank you.
So now that we're going to be having more graduates tomorrow, I would like to specifically move on to Professor Grace. What do students study? What makes them exceptional?
I've been here for 3.5 years now in Uganda, and I work across the 3 countries, across Tanzania and Kenya. And what I found here is that I've met some of the brightest, smartest students I've ever met in my career. And what we needed was just an avenue to be able to develop that expertise. So what we have now is really high quality programs, and we're graduating some of the brightest role models that we can for future, to improve the future of healthcare here.
Thank you, Dr. Grace. Mr. Joseph, just in addition to what she's saying, do you follow up the candidates? She's saying we have the brightest students here. Do you follow up the graduates to see what they're doing, how they're improving or contributing to the communities? Because I read somewhere, and what part of the objectives of this development, Aga Khan Development Network, is to ensure that they support one person, and then this person goes on to transform their communities. Do you sort of follow up the candidates to find out if they're actually creating an impact in their societies?
Yes, thank you, Sandra. And following up from Dr. Grace, yes, indeed, we do follow up our alumni. We have a robust alumni follow-up program in which we are able to track the types of initiatives that they are able to engage in, and where possible, even be able to support them. I know quite a number of them, and if you allow me a few seconds, I could take you through just a few of them. If we do a quick analysis of the types of projects they have initiated, these range from hospital or facilities improvement programs to community-based programs, prevention programs, programs that target primary health care, and I know that the success rate for some of those programs has been great. I know a number of them that have targeted daring programs, including rehabilitation of people who have been in drug addiction, start initiating new programs that look at improving community prevention programs. So the list is long, and yes, the Aga Khan University School of Nursing and Midwifery is able to follow them and be able to track them. We also as well do sometimes annual programs for them to be able to come back to the university and be able to interact with us. And just recently in December, we had our most recent alumni conference, in which alumni come together and able to inspire current students and even challenge each other and share new developments that they are able to implement in their communities.
Okay, and maybe for the viewer watching us tonight, you could be wondering, how does one join Aga Khan University? How does one do that?
Yes, thank you, Sandra. Joining Aga Khan University is quite easy. It's a university program that has been made for nurses and midwives. Like I said, in the 3 programs, diploma in nursing, degree in nursing, and degree in midwifery. These programs are carefully structured to target working nurses. We know that there are a number of schools in the country that support straight from high school programs, but the university has taken a special niche to be able to target nurses that are working, both nurses and midwives. And yes, they need to be already working, have a license to practice, and be able to go through our entrance requirements, which are not like climbing a mountain. It is something that is looking at what they have been doing, and I could say good quality, competent nurses able to go through our entrance requirements.
So what are we doing for the nurses that may not be able to go to afford to go through further education at Aga Khan University?
Yes, true to the testament of the university directive and values, our access program is able to target both candidates who are able to come and study in the 3 programs that we run, but for those that are unable to come to the university, or to even at one time of their life engage in a full-time program, because these programs are quite long, 2 years and more, we have a robust continuous professional development program in which we have trained quite a number of nurses and midwives. And these usually look at skills and competences that one needs to function and can apply immediately. Usually these are courses that are 1 day spanning over to 3 months. So there's always a dialogue with the different facilities to be able to identify their training needs and be able to run those. We have been lucky that we have partnered with an international donor, KfW, to be able to support those initiatives. And the school is created as a center for continuous professional development, which is able to bring nurses and midwives and equip them with the immediate skills that they need to function successfully in their workplaces.
Okay. Thank you so much, Mr. Kwizera. Over to you, Dr. Edwards. Do you think it is the right time for us to train, to give nurses more specialized training in line with the fact that there is increase in the number of non-communicable diseases in the world?
Yes, I do. There's a recent Lancet study that showed that 50% of deaths in Africa are due to non-communicable diseases, and that rate is rising in sub-Saharan Africa. So we're very aware of that, and we're very aware that we're working towards the Sustainable Development Goals, particularly Goal 3 and Goal 4, which is around good health for all and quality education. So we're very committed to underpinning our programs with those and looking towards helping to deal with the non-communicable rise of deaths in sub-Saharan Africa.
Interesting. So I know we're running out of time, but I would like to ask Dr. Buluki. I know Ugandans are definitely excited to have this state-of-the-art hospital and in our country, meaning that we'll have reduced number of people leaving the country to go to Nairobi to get this specialized treatment that we don't have here. But for the viewer or to someone that is watching us tonight, what should they expect once it is completed?
When this hospital is completed, we will have a capability to train Ugandan specialists here in collaboration with other universities. One of the areas that we have been focusing on before we opened the hospital, we have been talking to the government to actually take a group of the Ugandan physicians to Nairobi and the nurses for a year to train them and to prepare them basically for being able to provide the services at the quality level that we are looking for. Okay? However, this is not going to happen overnight because the university hospital in Nairobi has been there for 60 years. Okay? We are foreseeing that after 2 years or 3 years, we will be able to start with the first residency program and then gradually start building upon it. Right now, we are training, for example, specialists in 9 different specialties and some fellowships. Ultimately, that is what the Ugandans should be expecting, that we will be training the next generation of the Ugandan specialists in Uganda to make sure that the people receive quality patient care here and there is no need for them to travel out of the country.
So we have about 3 years to have the hospital completed, is that correct?
The hospital most probably is going to be 3 years or longer, because one of the challenges that we have, as I mentioned, since we are using all the North American standards, finding a qualified workforce that can meet those expectations and complying with those standards have been just a little bit challenging. And it might necessitate for us to partner with construction companies that they have those expertise to build it based on our expectations.
Okay, thank you so much all for joining us in our studios tonight, and we are definitely looking forward to have this Aga Khan University Hospital in our own country in Uganda, knowing that we can just cross over and get specialized treatment. So we're excited, and we're glad you could come to our studios to actually give us an insight into what the Aga Khan Development Network is doing for not only the country but even, you know, the world generally at large. And I also want to say congratulations. May you take it to the students from us here at NTV that are going to be celebrating tomorrow. We do wish them the very best moving forward. Thank you once again for joining us today.
Thank you.
Thank you too for joining us in this conversation. I hope you are excited as we are, and NTV Weekend Edition will continue shortly, so do not go away.